Hi, I'm Dr. David Hill, and today we're going to be talking about rhinitis in infants. Rhinitis, what is that? It's a fancy way to say runny nose. That's all rhinitis is, just runny nose in an infant. Now, infants get runny noses all the time, and there are a few different reasons they might have a runny nose. So let's go through those. Let's run through those. Okay, running through the runny nose causes, number one, viral infection, by far the most common. That is what? It's a cold. Virus gets up in your upper airway, it causes inflammation, the nose starts to run, it may get congested. So what are some things to remember? Well, one thing is that especially newborns have to breathe through their noses. So if a newborn's nose gets completely stuffed up to the point that they can't move air, they're in real trouble, especially when they're trying to feed. What are you going to do about that? Well, one thing to do is to make up a little bit of saline solution. Now you can buy infant saline drops, but you can also take a cup of water and a half teaspoon of salt at home, boil them, let them cool back down to room temperature, and voila, you've got your own normal saline solution for almost no money whatsoever. You just want to take a couple of drops of that, drop it in each side of the nose, 2 or 3 drops, and then get that blue or red suction bulb that you got at the hospital. If you lost it, you can get at the drugstore for about $3, and just suck that stuff right back out of there after a minute or two. You don't have to go way deep up in the nose. You just want to put it right there at the hole. That's all you have to do. You don't have to jam it way back in there to get all the snot out, and hopefully that will relieve the congestion at least long enough for your infant to feed or get a little bit of sleep. Now, one thing that worries a lot of people, they say, oh my gosh, the snot is green, what are we going to do? It's horrible, it's a bacterial infection. Yet we used to think that about 30 years ago or so, but we have since learned that the snot color is going to turn yellow or green almost every single time by about the 4th or 5th day of a viral infection. So green snot doesn't mean anything at all. It just means the cold is progressing exactly the way it's supposed to progress. That said, if the snot is going on for too long, if it's going on past about 10 to 14 days, we start to think we have a bacterial infection. That's commonly called a sinusitis. If we want to get fancy, we call it a bacterial rhinosinusitis. But that's more concerning. And that may be clear snot. It's the duration that impresses us. Again, 10 to 14 days. You might be thinking about using antibiotics for that type of infection. Now, the third thing we think about is allergic rhinitis. And all these things can be happening at the same time, so it can be pretty tough to figure this out. The hallmark of allergies is itching. Allergies tend to itch. You'll see as soon as a baby's able to reach their nose, they may be scratching their nose. They may scratch their eyes. You may see some sort of dark discoloration under the eyes. Those are signs of allergies. If you're concerned your baby might have allergies, a doctor can look up inside his or her nose and see if it looks kind of allergic and get a good history and physical exam in general, family history, see what the risk factors are, and consider treating allergies. There's really only a couple of allergy medicines that we use in infants. Claritin or loratadine or Zyrtec cetirizine are the most commonly used. However, you can talk to your doctor about what some of the options are. So talking about runny nose, rhinorrhea in infants, I'm Dr. David Hill.